Understanding digestive problems, causes, symptoms, and solutions. Digestive problems are a common issue affecting millions of people worldwide. These issues can range from mild discomfort to severe pain and can significantly impact daily life. In this article, we'll explore the causes, symptoms, and solutions for various digestive problems. What are digestive problems? Digestive problems refer to any issues that affect the digestive system, which includes the mouth, esophagus, stomach, small intestine, and large intestine. These problems can arise from various factors, including diet, lifestyle, genetics, and underlying medical conditions. Common digestive problems. Some common digestive problems include 1. Constipation, difficulty passing stools or infrequent bowel movements. 2. Diarrhea, frequent and loose stools. 3. Irritable bowel syndrome, IBS. A chronic condition characterized by abdominal pain, bloating, and changes in bowel movements. 4. Acid reflux, stomach acid flowing back up into the esophagus, causing heartburn and discomfort. 5. Inflammatory bowel disease, IBD. Conditions like Crohn's disease and ulcerative colitis, which cause inflammation and damage to the digestive tract. 6. Celiac disease, an autoimmune reaction to gluten, leading to damage in the small intestine. 7. Diverticulitis, inflammation or infection of small pouches in the colon. Causes of digestive problems. Digestive problems can be caused by various factors, including 1. Diet. Consuming foods that are high in sugar, salt, and unhealthy fats can contribute to digestive issues. 2. Stress. Chronic stress can affect digestion and worsen symptoms. 3. Lack of fiber. A diet low in fiber can lead to constipation and other digestive problems. 4. Genetics. Family history can play a role in digestive issues like IBS and IBD. 5. Infections. Bacterial, viral, or parasitic infections can cause digestive problems. 6. Medications. Certain medications can cause digestive side effects. Symptoms of digestive problems. Symptoms can vary depending on the specific issue but may include 1. Abdominal pain or cramping. 2. Bloating and gas. 3. Changes in bowel movements. 4. Nausea and vomiting. 5. Loss of appetite. 6. Weight loss. 7. Fatigue. Solutions for digestive problems. While treatment options vary depending on the specific issue, some general solutions include 1. Dietary changes. Eating a balanced diet rich in fiber, fruits, and vegetables can help alleviate symptoms. 2. Stress management. Practicing stress-reducing techniques like meditation, yoga, or deep breathing can help manage stress. 3. Probiotics. Beneficial bacteria that can help maintain a healthy gut microbiome. 4. Hydration. Drinking plenty of water can help prevent constipation and other digestive issues. 5. Medications. Depending on the specific issue, medications like antacids, laxatives, or antidiarrheal medications may be prescribed. 6. Lifestyle changes. Regular exercise, getting enough sleep, and avoiding smoking can also help alleviate symptoms. When to seek medical attention. If you're experiencing